Much is still not known about the coronavirus, said Executive Director of the National Centre for Infectious Diseases, Professor Liu Yixin. For instance, why some people get mildly ill, while others may die of it. Professor Liu also said some patients may be mildly sick for more than a week before the virus affects their lungs. Mild, non-specific symptoms include cough, sore throat, slight fever and fatigue. Several of those infected here who have no known links to China or other patients had seen a doctor 2 or 3 times before they were sent to hospital. But experts say Singapore's hot, humid climate is actually less conducive for the virus, as it thrives in cool, dry climates. Science and Environment correspondent Audrey Tan joins me now to go through some practical measures that each of us can do to fight the virus. Hi, Audrey. So, Audrey, you attended yesterday's press conference where infectious diseases experts were present. Now, on top of washing our hands and disinfecting surfaces, what else did these experts say we can do?
So yesterday's press conference was organised by A-STAR and some other research institutions in Singapore. So it was focused mainly on Singapore's R&D efforts on both the health and science fronts. But based on the available science, we can infer that there are some other tips that we can do. So the first thing would be, other than washing your hands and disinfecting surfaces, don't stay in enclosed rooms. Try to go outdoors, get some sunshine, try to turn off your air conditioner. These were some of the things that we can infer based on our available scientific knowledge.
Right. Well, of course, as much as we can, we'll try to, keep in ventilated spaces, but that's not always possible, especially, like, for example, right here, we're in an enclosed space in the office, or when we take the bus, the train, the taxi, for example. So what measures can we take after being in an enclosed space?
So yes, you're right, and the experts have also noted that the use of air conditioning is unavoidable, especially in Singapore. But one thing that we know is that one thing we can infer based on present knowledge is that this virus is very similar to other viruses that cause respiratory diseases. And these viruses as a whole, they tend to do better in cool, dry climates. So thankfully in Singapore, we have hot tropical weather. It's kind of a natural a natural environment is not conducive for this environment to thrive. So after spending long hours in an air-conditioned or enclosed room, maybe one thing that we can do is go out and get some sunshine, and where we can, try to avoid staying for long hours within an air-conditioned room.
Right, that's good to know.
I see that you have an image of the virus on screen.
Right.
So all these things work because for a virus to be able to infect its host, it has to stay intact. So the various measures, whether it be washing your hands or exposing it to heat, it disrupts this structure. So for example, if this virus is out in the sun, the heat from the sun as well as ultraviolet rays can cause this membrane to tear. So as I said earlier, the infectious diseases experts that I spoke to said that for a virus to actually be able to infect its host, it has to stay intact. So various measures, whether it's membrane tears or by washing our hands with soap and water and with disinfectant, it destroys these structures and makes the virus less intact. So once it's not intact, it renders it impotent.
I see. So Audrey, Duke NUS Medical School is working with the Coalition for Epidemic Preparedness Innovations to roll out a vaccine trial in Singapore, and that could happen as soon as 4 months. But what other forms of treatment are being explored?
So in very broadly speaking, there are 3 main types of possible treatment strategies which scientists call therapeutics. So obviously all of us would want a vaccine first because it's preventive, right? It can prevent the population itself from even getting infected with the virus in the first place. But for people who have already been infected, there are 2 possible types of treatments. One is called antiviral medication. And how it works is it basically targets the virus in the human body and prevents the virus from replicating. So you can think of it like the medicine is like a missile identifying the virus and like hitting it and rendering it unable to continue to infect other cells. Another strategy is known as monoclonal antibody therapy, which essentially involves a process that will help the body's own immune system fight the virus. So I'm working on a story on this, so stay tuned for that.
Oh, we will indeed. Thanks so much for your time, Audrey. That was Science and Environment's correspondent, Audrey Tan. And you can visit straitstimes.com for more on what infectious diseases experts said about the vaccine, as well as how to safeguard yourself against infection. Now, in the face of the outbreak, the Health Ministry's contact tracing teams work in 2 shifts, 7 days a week to find those who have had close contact with patients. Here's a look at the contact tracing process.
When Singapore confirmed its first coronavirus patient, the Ministry of Health activated its contact tracing team to identify individuals who have had close contact with coronavirus patients. But how is contact tracing done, and what are some of the challenges involved? Dr. Oliver Oh and Mr. Priyam Raj, who lead the contact tracing team, explain. When a coronavirus case is confirmed, the hospital will create a detailed map of the patient's movements and contacts 14 days prior to the onset of symptoms.
So once we have a confirmed case, we initiate this process called activity mapping. This is done by the hospital at which the patient is warded at. So the healthcare worker caring for the patient will interview the patient and basically get information on where he has been prior to the onset of symptoms, up to the point that he was admitted and isolated in the hospital. So this is a full movement history of the patient, all the places he has been to and the people that he had contact with.
The contact tracing team tries to verify the activity map, including with airlines and transport companies, and identify a list of close contacts who are those at risk of infection.
There's no hard and fast rule to define a close contact, so it depends on the length of exposure. For example, whether the person was wearing any personal protective equipment, and also the type of activity they were involved in. So we have to take all these things into consideration before we decide whether a person is a close contact. Assuming the patient was infectious during the flight, then we will actually obtain the flight manifest through the airlines, and we'll then identify persons who are seated within the certain vicinity of a case, 2 rows to the front, 2 rows to the back, and the row itself, so a total of 5 rows.
Callers then reach out to these close contacts and check if they are feeling unwell. Close contacts who are well will be served a notice of quarantine and given the choice of staying at home or going to a government quarantine facility for 14 days from their last contact with the patient. Those who have coronavirus symptoms are hospitalized in the isolation wards and tested for the virus.
For the contact tracers, currently we have activated 7 teams of 10. At any shift, we have 3 teams on duty. During peacetime, we have established a pool of contact tracers, and they have been given regular training on the contact tracing process.
I guess some of the challenges will probably be trying to locate individuals who are foreigners, because they don't necessarily stay at one location and may not have a working phone number, so trying to contact them and locate them can be quite challenging.
Another team analyzes the data from all patients to see if there are any overlaps, including the places they have visited or people they have met. Any linkages are flagged.
If the public does get a call from the MOH Contact Tracing Centre informing them that they have been in contact with a case, we would like to advise them to be cooperative to provide as much details as they can.